I'm Dr. Babak Larian.
And I'm Dr. Babak Azizzadeh.
So oftentimes when patients come to me with a parotid tumor, and these tumors tend to happen more often in people who are a little bit later on in their life, and oftentimes they ask me, is it possible for me to do a neck lift, a facelift at the same time? And really truthfully, in fact, if you're considering it, this is actually the ideal time because the incisions that I use to do the parotidectomy is very much in line with an incision for a neck lift or the facelift. So then I introduce them to someone I really prize and I'm proud to be partners with, Dr.
Yeah.
Babak Azizzadeh.
Yeah, I think it's been an interesting journey with
Yeah.
us because we've been doing this for almost 21 years. And when we were training together, it wasn't something people even thought about. But obviously, over the last 2 decades, it has become more and more of a consideration for individuals. And we found out a few really, really interesting things. And I think one of the factors is that not only are the incisions right there and then, but the fact that facial nerve dissection during a parotidectomy can kind of make that natural anatomy different.
Yes.
And everybody does parotidectomies differently. I mean, Dr. Larian's magic is that with parotidectomies, you cover the nerve, it's protected, but there are times that people don't cover the nerve.
Right.
And so if someone goes back and does a facelift, that nerve can be in danger. So that's the one really great thing that we can do it. It saves an anesthesia session. The other advantage that we actually ended up incorporating was it actually helps our reconstruction.
Yeah.
Because we use that deeper layer. We do facelifts in a deep plane, which means like we use the deeper layer tissue to reposition the face. And those deeper layers can be used to reconstruct the divots and the empty spaces and so forth. And on the opposite side, we can actually narrow the area of the parotid so we get a really, really nice symmetry. So those are some of the things that we actually published this in a very important scientific journal. And the results have been, I think,
Amazing.
like every patient is very, very happy. We haven't had, any significant complication additions to what you usually have for facelifts or parotid surgery.
No, we haven't. Fortunately, we haven't had that. We're both so neurotic.
Yeah, we are. We're detail oriented. One thing that we do, this is really we always go into two major important factors. And I think the tumor has to be benign.
Yes.
It's not, if someone has a possibility of a cancer where, facial nerve may be involved, other factors,
Right.
we don't do that. We can do it later, but not at the time. And the other factor is we always say we may go in, we always do the parotid side, but if for some reason we're like maybe not concerned about the facial nerve or something like that, we will not do the other side. Now that hasn't happened, but that's one of the things that we always discuss with our patients.
Yeah. We're prepared for all possibilities, basically.
Yeah.